Coming to Cochise Oncology has been the biggest gift because getting that diagnosis and having to come to a place like this is hard enough. But from the time you walk in the door, you're met with smiles, you're greeted by name, you are put at ease.
I think taking care of cancer patients is a very holistic approach. You have to have the right technology, the right equipment, and the right staff to deliver the care. From a technical standpoint, this is a very well-equipped practice. We offer a full spectrum of services in medical oncology, infusion services, radiation oncology, pain management. Skin cancer is by far the most common cancer in the United States. We're now offering full skin screenings and biopsies for any suspicious skin lesions. We have the highest quality of care possible.
The vision behind Cochise Oncology was to offer excellence in patient care in our local community. I wanted a place where patients wouldn't have to drive a distance to get care for their cancer, where the staff would treat them in the best possible way, where they couldn't get better care. I'd been in radiation centers where we were in the basement and you felt like you were in a tomb. And so I wanted wide halls and light, making the facility seem welcoming and not medicinal.
I was scared to death. You know, cancer's a nasty word to have to hear anyway. But when you meet the people here, they make you feel that everything's going to be okay. They're such a team.
When a person is diagnosed with cancer, it's not just one doctor who's involved. It's usually a team of specialists. They meet every week to discuss every patient who's undergoing treatment, and we all come together and invest in the care of the patient. The physician will give me an order for the radiation. I complete a treatment plan for the patient, which is then reviewed by the physicist and the physician. Upon completion, we'll give it to the therapists who carry it out.
I bought a Tomo. The bottom line is I bought one because it's the best. Radiation first started as a big square of radiation coming out of a machine, and the patient would lie under it. We knew that we wanted to shape the radiation. We didn't want this big square because cancers don't come in big squares. They come in odd shapes. Tomotherapy is multiple pinpoint beams that come in a half-centimeter slice from multiple ways, and then the patient moves in and they do it again. And so there's so many potentials of where the radiation is going to come in, and so if there's something in the path that we don't want treated, the optic nerve, the parotid gland, something that we want to preserve, then we can have that beam come another way.
One of the great things I love about Cochise Oncology is the open communication. I think we work very well together when the doctor comes in and says, oh, this patient needs to get started on this. You know, it's boom, boom, boom. We know exactly what steps to go to, and it gets done.
The physician checks every day the treatment plan from one of the radiation machines to make sure that we give the best possible care every time.
Being treated at home, my support group was in place. My family, my friends. Before I even met everybody here, I had that support group. So if I had made that trip to Tucson all that time, it would have drained me. It would have been too much. I would have probably had to book a place for 5 days. That would have gotten old and expensive.
So we have 2 hospitality houses for patients that live out of town. So these houses are about 5 minutes away from the clinic, and they're fully furnished. They have all the amenities that they would need. They're in a nice, quiet community. Both homes are free of charge.
We're the only cancer hematology specialists that serve this region. The treatments are going to be as good here locally as they would in Phoenix or Tucson. But the care is better because you have a set of providers here that know the patients. The continuity of care is better. A lot of times the patients go to Tucson. They may or may not see the same doctor every time, and it's just hard to keep a close eye on the patient from a distance.
I would have had to go to Tucson or maybe Phoenix. That's a long way to think about what's going to happen when you get there. I think it would have been a lot more stressful.
I would certainly encourage patients to, if at all possible, try to be treated close to home and family, because the social support that you get when you're being treated in your own community, close to home, with all that support from family, friends, and the local community, is almost as important as the actual care that you receive from your cancer providers. And there are a number of studies that have borne that out.
The radiation therapy and the chemotherapy or medical oncology is top of the line. And why would you go to the big city to get something that you can get in your hometown?
Pretty much anything that's available at the big medical centers in Tucson and or Phoenix or any other large city are going to be available to us here. Previous infusions in this part of the state were done by the local hospital. Once they stopped offering that service, by Dr. Nettleton and Cochise Oncology offering that here, that saves folks a lot of time and gas.
You know, we do hematology oncology, which is a specialty in blood problems as well as when they have problems with cancer diagnosis. So we see a lot of anemia, fatigue problems, low blood counts. We are providers for the local hospital. So if a patient is sick enough to be admitted to the hospital, we'll see them there.
We accept the full spectrum of Medicare, Medicaid, military, VA, TRICARE, and private insurance plans. So we've tried to design the practice in such a way that no one gets turned away.
When a patient's insurance have a high deductible or a high co-insurance, we kind of sit down and see if there's any patient aid funds or any co-pay assistance programs that patients qualify for, and a lot of the times they do. So that way, once they're on treatment, they don't have that worry or stress while they're getting their treatment here.
The insurance specialists here, I don't know how I could have got through the beginning of this without them, because they walk you through everything. I think that in the beginning was the most stressful part of it, trying to figure out what am I gonna do, and got us to where we were able to focus on just the care part of it and getting mom through it and being supportive and being happy and not stressing out on the money.
Everybody that I work with at Cochise Oncology is basically handpicked. Dr. Nettleton had a goal when she started this clinic of what she wanted the primary goal to be here.
Early in my career, I worked in a facility where it was a large facility and the patient really wasn't first. I had an experience where there was a young woman with children and she had a recurrence of her cancer and it was no longer curable. The staff in our department was short with her. That incident is what made me want to build a center where patient care really was first.
So Dr. Nettleton, to her, patient care, that's number one. And it's instilled in you from the first day that you get here, even from your interview. A lot of people, they talk about patient care or they talk about the customer service aspect of it, but she really is all about it. You're here now, you're at Cochise Oncology, you're part of our family, we're gonna take care of you.
Whether it's an ear to listen to what's going on, whether it's a medication, whether it's a whole new direction that we need to go. The patient is who comes first, and that's who the entire focus is on.
One of the most important aspects of the job is to make sure that the patient understands what the treatment is and why we are doing that, and to answer their questions so that they feel comfortable with the care that they're giving.
I never felt that I was ever limited by anyone here. If I had something I needed to ask a question about, they gave me all the time in the world.
I love our graduations. And we have lays and everybody stands out there and claps, and some people actually do a jig down the hall.
And we make a big deal of it. It's a big step, finishing therapy. The whole gang will be back there. We clap and cheer and have a good time, and we celebrate their accomplishment.
Coming here during the treatments and all of that, it's strange to say, but it's like it almost brightened her day. She was happy to know that she was going to go see smiling faces. She was happy to know that she could walk in the door and she's going to be, hi Candy, how you doing? And put immediately at ease.
Not that I want to have the cancer, that I don't like it all, But I couldn't have gotten through it without the people that work here. Like I said, I don't know how they do their job sometimes. To do what they do and do it with the smile and the care and the compassion that they have for everybody who walks through that door.
I love having a patient finish with treatments, seeing them with their follow-up and their scans being clear. It's one of the best days for us. It's truly a celebration.